I'm Dr. Mudit Khanna, Senior Consultant Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. I have special interest in performing hip and knee replacements, particularly hip replacements through a minimally invasive direct anterior approach, as well as my total hips through a minimally invasive muscle-sparing subvastus approach. I also specialize into Makoplasty or partial knee resurfacing that is done using the Mako Robotica. Today, we will be talking about Mr. Russell, a 69-year-old gentleman who came to us all the way from New Zealand.
Hi, my name's Russell Eddy, and I come from New Zealand. I'm 62 years old, and I had been having trouble with my left hip for the last 7 months, and heard through the media in New Zealand that people were coming to India to undergo surgery. So I did a little bit of research, and via IndiCure they hooked me up with Dr. Mudit Khanna.
He presented to us with significant degree of pain and limitation of movement in his left hip joint. He was a bit on the heavier side. So what we discussed with him was predominantly about what approaches we can use to sort of get to the hip before we can actually perform a replacement. So what was put forward to him was essentially whether we were to go from the front. Now this is known as a direct anterior approach of the hip. And in this particular approach, you do not need to split or cut any muscle whatsoever.
The experience in the hospital here has been absolutely fantastic. Everybody has just been so helpful and very, very obliging. The nurses, the admin side of things, we were getting visits every day from I'm assuming a lot of the management people for the hospital checking on me to make sure that I was happy, everything was all good, and I'm not sure whether I would have had the same experience back in New Zealand. They seem to really look after you here, and to ensure that you are happy and that you're getting the best of service. And the surgeon, and going through the operation of again there, I'm just totally amazed how fast that I've recovered.
Despite being overweight, which is a relative contraindication to perform the procedure, he was very keen for us to go from the front because he wanted a quicker recovery and wanted to be back on his feet. This approach therefore allows you to perform a hip replacement without detaching or splitting any muscle whatsoever. Now this leads to a much quicker recovery. I would say patients are walking up and about even without the use of a walker all the way from day one. What you are going to see in the video is his recovery right from day 1 to day 5, and then when he came to us for removal of sutures, which is day 14, he's already completely independent, walking without any kind of limp, able to put full weight on his legs, able to go up and down the stairs with absolutely no discomfort. This kind of amazing and fast recovery is probably only possible with a direct anterior approach because of the fact that we do not cut or split any muscle.
Yeah, the recovery is in there with the anterior hip surgery, and I am very, very happy with the way things have turned out.
If you wish to know more about what a direct anterior approach to the hip means, please visit us or contact your healthcare provider, who can then guide you further whether you're a good candidate for a direct anterior approach to the hip or not. Hip replacements can get you back on your feet without the use of a walking aid right from day 1. You could potentially go back home on the same day if you have a minimally invasive muscle sparing DAA type of hip replacement procedure.